During the pandemic, rates of kids headed to the ER with mental health issues skyrocketed. The numbers remain high. In a new study, researchers looked at the records of more than 28,000 children ages 6 to 17 who visited the ER with mental health issues. They found that less than a third of them had supporting outpatient mental health visits within 7 days, and only 55% had a follow-up visit within 30 days. With that, Dr. Salim Sourani joins us live with why crucial follow-up care is so critical. I don't want to put this on doctors, I want to put it more on the parents. The parents need to remember to follow up with their kids and make sure they get to those doctor visits for follow-up. Would you agree with that?
Good morning, John Thomas. Glad to be here. I think the challenge is twofold. It's not only that, the parents doesn't want to follow up, but the number of the providers are very scarce. We know before even the pandemic that almost 20% of the kids are suffering from mental health disorder. If you look at it, 50% of the mental health disorder are diagnosed before age of 14, and 75% of them are before age of 24. So if we can diagnose it early, we can get the follow-up, that's a good thing. The challenge is twofold. Because there is a very severe shortage of mental health providers, a lot of them are not able to see them before. The ER, they should not be going in because that's a safety net place. So when they go to the safety net place, then they want to make sure they stabilize and they can have them follow up. As you mentioned, that most of them are not able to follow up with their mental health provider. So I think this is a national emergency. Not only that, there's two things with that. It's also the disparity populations are even less able to follow with their mental health provider. So the challenge is even more. So the only thing with the people with the disparity or some of the children have is the school counselors or behavioral psychologists at the school who can provide. But if you look at the number, it should be 1 out of psychologists for 500 kids. But what the average number you're running is 1 in 1,200 or 1,300. And that is even worse, that a lot of the counties don't even have the child or adolescent psychologist. So I think it's a big challenge. Parents needs to be aware, the education needs to be there, the infrastructure, the family support, the providers. So I think you have to take a multi-pronged approach.
Really quickly, where do parents need to go if not the ER?
One of the main thing is that they can call the number, the suicidal line.
988?
Yes, 988 is the national number where you can call. So.
Okay, Dr. Sourani, thank you. I know you wrote a paper about this and the pandemic and effects on mental health in kids. That's something we can link to later after this interview. But thank you for being in here. We really do appreciate visiting with you live, sir.